Fantastic. Okay. Hi, everyone. Good afternoon. Thank you for joining us for this press briefing by our speaker today. This is Dr. Tlaleng Mofokeng, UN Special Rapporteur on the right to health. The Special Rapporteur is in New York for the presentation of her report to the UN General Assembly's Third Committee, which looks at human rights issues. And a reminder that all Special Rapporteurs are independent experts and carry an independent voice from the United Nations. We will begin with a few remarks from the expert and then open for questions. Special Rapporteur, you have the floor.
Thank you very much for that introduction. And just to say that I am very honored to be doing this press briefing at the UN headquarters. I presented yesterday to the Third Committee a report titled Health and Care Workers, the Oath Takers and Defenders of the Right to Health. And that report and that address yesterday in the interactive dialogue was my final one as a Special Rapporteur at the General Assembly. And so it has been a moment for me of deep reflection on the right to health over the last 6 years. And it has been important to me as a person who embodies many of the characteristics that lead to prejudice and discrimination and criminalization. Being a black person, a black woman from South Africa, the global majority, the so-called global South, who herself is a childhood survivor of a brutal apartheid regime, who is a medical doctor though, and of course the UN Special Rapporteur, but continues to live under the crushing weight of racism, sexism, ableism, and the legacy of colonialism and imperialist violence and those systems of oppression that it continues to sustain. And so it was important to me, the Special Rapporteur, to bring this perspective on the impact of racism, for example, on human dignity, life, non-discrimination, equality, and the right to control one's body. And to also make a case that there are reasons, historically and currently, why some countries are unable to realize the right to health. And during my tenure, I've doing my best as I could with the methods of work afforded to me. And I've done this through amicus briefs, through the different judicial processes around the world, the annual reports, country visits, and communications, for example. And I've done this to give a voice to those in situations of marginalization, and have been a strong advocate to the restoration of dignity, to achieve it through the right to health frameworks, and advocating. And of course, for me, it has been very important to see the different ways and hear the different ways that the mandate has had a positive impact on the situations of some of the rights holders. And I'm really convinced that the right to health is the most dynamic right, the most interconnected right, showing us the most how in today's world, in terms of challenges, but also the potential and the positive narratives that are out there, that if we get it right through the right to health, we can really enable other human rights like economic, social, political, civil rights as well. And the right to health has brought populations and countries closer together, facilitating an exchange of ideas, scientific advancements and know-how and tools. And also as we move towards universal healthcare coverage, there's been a lot of resolutions and a lot of work that member states have done. And it is my hope that the work of this mandate has strengthened those resolutions, and that we understand that primary care ultimately needs to be strengthened as the crucial cornerstone of modern medicine and public health, but that we must see the rights of health and care workers as central to that. And in line with the reaffirmation by states that all human rights are universal, indivisible, interrelated, and interdependent and mutually reinforcing, I assert that health and care workers are key defenders of the right to health. We need to understand health and care workers as defenders of the right to health. We know in the last 2 years, and we've witnessed a genocide, how the destruction of health systems, health facilities, and healthcare workers themselves have been attacked. The totality, the speed, and the scale of the destruction, giving us new words and concepts like medicide. Criminalization, stigma, and exclusion of historically marginalized populations from essential health and care services exacerbate health inequalities. And so it has been important to adopt anti-racist and anti-colonial analysis of the right to health. And it does remain key, and we must continue to question everything and interrogate the power analysis that exist, the commercial determinants of health, the impact of business and their unwillingness to understand and cooperate using human rights frameworks, understanding the political determinants of health. The practice of medicine itself is being used as a political tool. The attacks and harassments and threats of violence against healthcare workers, health facilities, humanitarian workers, and underlying determinants of health continue to catapult many humanitarian settings and, of course, the genocide to proportions yet to be fully quantified, if at all possible. Health and care workers have been targets of violence in their homes, in the hospitals, in transit, on duty, through abductions, killings, torture, and there has been no accountability for any of this. Health and care workers are not targets. They should never be targets. Yet, perpetrators of attacks and threats against health and care workers in clear violation of human rights law are not held accountable. In Gaza, from 7 October 2023 to 5 October 2025, 1,722 healthcare workers have been killed. 1,722 healthcare workers have been killed. In Sudan, between 9 May and 28 November 2024, 13 attacks on health facilities in the city of El Fasher were documented. And between 1 January and 30 June of 2025, at least 30 humanitarian and health workers were killed. These acts reflect systemic challenges and gaps in protecting health and care workers, which is why I highlight them as defenders of the right to health, as human rights defenders, because the conditions and the context in which they currently operate are very different from even just 5 years ago. And so our understanding of what it means to be a health and care worker has to really shift and change to respond to the urgency of the needs. I just want to close by saying that I fulfilled my mandate viscerally aware of all of the challenges that people experience. I share in the rage and the fury of many people around the world. And I want to say that I'm very ashamed and deeply sorry that the world has failed many people. And I hope that one day that the world will share a different kind of connection. A connection that places first and foremost human dignity at the center. A connection that isn't based on experiences of imperialistic violence or what it has taken from us, from our futures. And that through the mandate of the right to health, rights holders, citizens, can find hope in the multilateral system, in the tools and the methods that are afforded to special rapporteurs to do their work. And I remain in unwavering solidarity with all healthcare workers around the world, the oath takers, the ones who stay, often knowing that death awaits them. The right to health enables other human rights. They enable us to create, to imagine, to live, to be, to thrive, to have joy, and not merely just survive. And as we've seen through many children, that listening eyes, their burning flesh, amputations, thirst and starvation, we have witnessed a collective, indestructible human spirit, and that the human desire for freedom can never be extinguished. And I want to say to member states and to all stakeholders that the extent to which you measure your own success in your own countries, the extent to which sustainable human development, peace and security has been achieved must be measured and understood by the extent to which human rights are protected, promoted, and fulfilled by all member states. And before concluding, I want to say that the reports I have produced over the last 6 years were very intentional. The idea that the right to health is a justiciable right is very important. And so I wrote the reports knowing that there are many stakeholders who will draw different aspects from it. And I hope that they will not remain just a footnote, collecting dust somewhere in the UN archives. But for those who do want to hold different people accountable, including member states, on their obligations, those reports were written with that in mind. What does accountability look like? What does justice look like? And so it is my hope that they also not just give us new concepts and advance human rights, but give us really tangible ways in how we can use the right to health as a justiciable right in the restoration of dignity, but also understanding accountability. I want to share an excerpt of a poem with you in concluding. Maya Angelou said, "You may shoot me with your words, you may cut me with your eyes, you may kill me with your hatefulness, but still, like air, I rise. Out of the hearts of history's shame, I rise. Up from a past that's rooted in pain, I rise. I'm a black ocean, leaping and wide, welling and swelling, I bear in the tide. Leaving behind nights of terror and fear, I rise. Into a daybreak that's wondrously clear, I rise. Bringing the gifts that my ancestors gave, I am the dream and the hope of the slave. I rise. I rise. I rise. And these are my last words to all of you in New York at the General Assembly, marking my ultimate address to the Third Committee, to all of the people of the world who are oppressed and marginalized, vulnerable and stigmatized and criminalized. I do not know when, I do not know how, but I do know that we win, and you will rise. Thank you very much.
Thank you very much, Special Rapporteur. I'll now go to questions in the room. Sure, go ahead.
Thank you, Dr. Mofokeng. I'm not quite sure how to ask a question after that, but we'll try. Your powerful remarks there. I'm Gabriel Zondo from Al Jazeera English. Congratulations on the end of your 6-year term, if you will. You touched a lot on Gaza, and thank you for doing that. And I guess I want to ask you, can you reflect back a little bit on the last 2 years and where you think the international community failed the medical workers of Gaza and what perhaps could have been done to stop it? Not sure quite how to frame that. I'll leave it at that for now.
Thank you very much. So part of the deep reflection that has happened for me and why I decided to do a report for health and care workers for the General Assembly, especially because in this space in New York, of course, the issues of peace and security, the Security Council is here, issues of development are discussed a lot here, was to position health and care workers as defenders of human rights, precisely because of the failures of the international community to summon the necessary networks of support in terms of resources, in terms of mental and physical health for health workers themselves, they were also starving. As the population of Gaza was being starved, they too were starving and still having to show up for work, and they were doing that. And so the insistence on my end that we should actually understand health and care workers as human rights defenders is because there are particular obligations that come with understanding them as human rights defenders. There are particular ways in which the medical fraternity has completely let down our own colleagues in Gaza. It took 2 years for some world professional bodies to even accept and say as much that what's happening in Gaza is unacceptable, and some of them can't still say that it's a genocide. A lot of our colleagues who are in Gaza and have done interventions from the Right to Health mandate writing to Israel on an urgent appeal and other communications solely on health and care workers who were being abducted, disappearing, who were jailed and detained without any reason. Some died with signs of torture on their bodies. Others are still being detained as we speak. And so the failures are catastrophic, because we know that health and care workers are also protected under international human rights law, humanitarian law, and they are not just collateral damage. And so this idea that health facilities and healthcare workers were just collateral damage is absolutely unacceptable as well. And my shame comes from also being a healthcare worker myself and being a doctor, and understanding that I would probably make the same decision and not leave my patients. I would also not take those evacuation orders, and that I'm in this role as an independent expert and I'm unable to move and shift the necessary people in power and authority to actually take action. And in those 2 years, in terms of reflecting, I've written to the President of the General Assembly, the previous one and the current one, the Secretary General, the High Commissioner, including Pope Francis before he passed away, appealing literally to all the leaders to say, yes, diplomatically there's work happening at the General Assembly, at the Security Council, but there is much more that ought to be done. And so for me, it's reflecting with a deep sense of just let down. And the medical fraternity, the medical professional bodies have let our own colleagues down as well. And so who speaks on their behalf? Because they are busy saving lives. Literally. They are busy saving lives while they themselves are starved and thirsty. And that's the context of, and that's why these issues are urgent. And the report, of course, is a thematic report for the UN, but it's also designed to inspire what could be possible if we understood health and care workers as defenders of human rights. How do we do this in a local, regional, and global space? And so the recommendations are at least to try and fix some of those challenges that have emerged out of Gaza. The same is happening in Sudan, where our colleagues are being killed and health facilities are being attacked as well. So protracted conflict and violence, for example, in Haiti, gives us, the same challenges. Our colleagues in Cuba are talking about unilateral, sanctions. All of this speaks to, again, the level of imperialist violence we are still living with. It's not in the past. It's very much in the future. And so part of what we need to do can't just be in silos, isolated. We need to think about the bigger systems and structures that need to change, that enable a genocide to even happen in the first place. Thank you.
Please go ahead.
Thank you, Doctor. This is Abdul Hamid Sayam from the Arabic daily Al-Quds Al-Arabi. I listened tentatively to your remarks, heartbreaking. But I have few questions. Maybe it was in the report, but not in your remarks. You just mentioned 1,722 health workers were killed in Gaza. First, you didn't say who killed them. I need to hear that word, because many of you and officials talk about those who killed, but they avoid mentioning who killed them. Second, I want to hear more about attacking hospitals, clinics. the child mortality, the famine, the premature babies, the pregnancies. It's all under your mandate, I guess. And I want to read the report. Maybe they were included, but I didn't hear it from you. And the second question related to that, in the last 2 years, we have heard many vocal voices coming from special rapporteurs, first and foremost from Francesca Albanese and a few others. I mean, could you share with us, how many times you issued a statement and...
Me?
As a rapporteur for the right of health, maybe you did. I'm not saying that maybe it's my ignorance but I try to follow everything happened, but if you can share with us your statements in the last 2 years. Thank you very much.
Thank you. So in the last 2 years, I think outside of Francesca Albanese, I probably am the most active Special Rapporteur on Gaza. I have issued more than 30 statements on Gaza. I was the first person in 2023 to call what's happening in Gaza a genocide. In 2023, I called it a genocide. Of course, there was fierce criticism and pushback on that. I did the same in April, March 2024 in Geneva. And, there was a reporter who said, oh, you've said genocide 4 times in your statement. Are you sure what you're saying about what's happening in Gaza is a genocide? And I said, yes, it's a genocide. It's simple. There's no qualification for it. So, yes, in terms of going back to look at the right to health mandate, I think you'll be very surprised to see the amount of work that has been done. What is important, and sometimes politically so as well, depending on the context and what's happening, sometimes I choose not to give time to Israel as an occupier and an illegal occupier. Sometimes I choose to center Palestinians and in the ways in which I speak about them, humanize them. And I don't need to do that by constantly having to mention Israel. And it's a deliberate political choice that I make. In many instances, in the press releases and the formal work, absolutely you will see there. And in many other instances, even yesterday when I did my remarks, I stated in no uncertain terms within the first minute that Israel is committing genocide. And I went further to say, and they must be held accountable. So I think it's just a matter of, keeping up with what's happening. Evacuations in Gaza, in terms of my mandate, have been happening since before October 2023. And I think it's important to say this, that 2023 was an escalation of violence, but the violence that Israel was committing in Gaza had been going on before that. Before October 2023 was already the highest number of children killed by Israel in Gaza. That was before October. In 2023, Israel had already killed more children in Gaza in the history of that violence. And that was before October 2023. And the evacuations are often denied. And there are people with chronic illness, there are people with cancer, there are children who need their parents to accompany them for treatment, and often their parents are denied access. And then they say, no, let the children go on their own. Or families are separated somehow in that seeking of medical intervention. Post, of course, and during this genocide, there have been countries who were willing and able to help the injured population. Because remember, part of why this is a genocide is that you are bombing a population, causing harm, using all sorts of dangerous weaponry. You are destructing health facilities. And so you are saying, even if you survive the bombing, you will die of the injury because we've made sure there's no health facility to help you and to support in the trauma response. And so that's why this is so incredibly enraging, but so incredibly evil as well. In South Africa, for example, there's a hospital in Centurion that had helped the children of Gaza, especially the ones who were amputees, helping them with physiotherapy, debridement and surgical interventions of their wounds. But the fact that as an illegal occupying power, Israel still has the right to say yes or no to people entering Gaza, They still attacking the flotillas that are trying to bring humanitarian aid. We need to understand that that occupation itself is illegal. And as an illegal occupying power, they still have obligations though. And they are not even keeping up with those obligations as we see. And they ignore even the International Court of Justice. So that's the state of affairs, you know. Yesterday, there were other advisories from the ICJ. We need to study those and see if there's timelines that we need to follow up on. But the previous advisories' timelines expired in September. What is the next action? What does accountability look like when they ignore the ICJ? And so those are important conversations to be had. But in terms of the right to health mandate, we've been acting and responding even before October 2023. Of course, the work has become heightened and more because of the type of violence and the escalation of violence. But we need to remember that this is before 2023, that Gaza's population was already suffering under conditions that enable a genocide. The conditions were already there to create and enable a genocide. Yeah.
Can I follow up with just a little
Yeah,
bit?
you can.
Yeah, it's about the West Bank, if you can also tell us more about your...
Yeah, we've been monitoring the West Bank and East Jerusalem as well in terms of settler violence that's happening there. And it's important also to not just, of course, look at the Gaza Strip, because when you are just only looking at Gaza, there's a lot of violence that then starts elsewhere. We had the issues, of course, in Lebanon as well when they were being attacked, to remind each other as colleagues to say, let's keep an eye on everything else, because what also is happening is that land is still being dispossessed. Fertile land is still being possessed. Even the so-called peace deal, right? If you look at the demarcation, most of the fertile land that the population need to plant, to grow food, is being taken away from them. And so even back then, when I used to say that the evacuation orders were merely making space for more land dispossession, that's what the evacuation orders were doing. And we see it now with how they've demarcated the space and what they, in the so-called peace deal. It's very worrying. And in my mandate, we have absolutely been keeping an eye on the West Bank and East Jerusalem. And there particularly, it's individual citizens who are, of course, emboldened to be doing those kinds of attacks on civilians of Gaza, of Palestine. Yeah.
Shervin Briceby, South African Broadcasting. Dr. Mofokeng, can you talk about the personal toll that being a rapporteur has taken? I know your colleague Francesca Albanese is now moving around with the security detail. So I wonder if your security has ever felt impugned given the strong statements you've made on various topics. Talk about the personal pressures and whether you get the requisite support from the structures that are the United Nations, given your independence.
That's a tough one, because there's things I can say publicly and there's processes that remain confidential. I think it's expected when one does this work that there will be some pushback. And many of us expected, and in fact it would be odd because we push the envelope so much, and I do, that there would be no response. So I expect in this diplomatic space, dignified engagement. What has been worrying is that it seems that we have lost that decorum. We have lost the ability to engage with each other, even though we may have differences. There's a line that we simply just would not cross. And personally, I feel that personal line of protection has been crossed. It no longer exists. So not only does one feel unsafe because of the work, but you literally physically feel unsafe as you move around from one space to another. And I think that is by design, to make us feel intimidated and to make us feel harassed. I think it's part of the psychological warfare. I've been in instances where, even my own hotel room was compromised on official mission. So those things you don't take lightly. I think it's important as well to realize that, even as a medical practitioner, I experience pushback, intimidation through the use of professional bodies in the country where I am. I experience pushback in terms of, for example, a parcel sent to my office in Washington, D.C. Those are intended and they're specific actions that people take. And yes, you can brush them off as it's part of, doing the work. But it's not part of doing the work. I think there ought to be a way of thinking about what it means to be a special rapporteur at this moment in time and going forward, where you are doing unremunerated work, where you are then exposing yourself through the work to a lot of possibilities. And if those possibilities include threats to personal physical safety, I think we ought to be thinking very hard, and the UN has to be thinking very hard about what it means and what kind of support they can give. The last 2 years have been very interesting, to say the least.
What was in the parcel that was sent?
It was disgusting. It was sexist and racist remarks, and other things in there. I don't even know if I can mention what those other things are. It was really disgusting. Should I describe it? There was feces in there, sent, and I think, of course, it's intentional. It's meant to obviously intimidate you. And what do? Right? I can afford security detail. I can afford anything except be myself and do the work. And yeah, that's what it takes in this moment in time. 5 years ago, it didn't take all of this, but now it does. But how do we think about the future? It's important. It's a very important question. How does the UN think about how the work and the role and the exposure of experts has changed? Because it has changed, and of course there are more people who are more vocal than others, right? But I think systemically there has to be a reflection on what that looks like. Because I feel like many lines have been crossed, to be honest with you, in terms of how people engage or how they register their, disapproval on some of the things. Yeah, but it doesn't sway us. Well, at least doesn't sway me, because I think my commitment is very, very clear. And perhaps it's part of my own history, having been a child who grew up in apartheid South Africa. No one has to tell me what's happening in Gaza. I grew up in apartheid state. I know what it's like to have military police 24 hours a day. I know what it's like to have UN helicopters drop toothbrushes and toothpaste in your schoolyard. I know that feeling, right? It's not the same intensity, but the commitment and why I'm so unreasonably committed to justice and to ending imperialist violence, it's that first-hand experience. It's not an academic exercise. For me, this is not an academic exercise. It's about real life and realizing that even I was not even meant to survive. And that I did not just only survive, but I'm now in a space, in an institution. And how do you then use that proximity to the UN to the best of your ability, but understanding and being cognizant of all of the people who are marginalized and made vulnerable by systems? Because I myself were not even meant to survive. So now that I'm here, my commitment is much more radical than just churning out academic reports every other year. Yeah.
Please go ahead.
I want to ask you if you have contacted Israelis about the Dr. Hussam Abu Safiya, if you managed to reach out to know what's going on, if he will be released or not. And another crime which is related, Dr. Ayat Najjar, they killed her 9 children and husband.
Yeah.
How did it resonate with your office? Thank you.
We have lists of names of of our own colleagues, from paramedics to nurses to administration staff of hospitals to ambulance drivers. I mean, back in the beginning, 60 ambulances were completely destroyed in those first attacks. And even Dr. Al-Bush, we had intervened in that case. And my advocacy is both within the UN, so I communicate to Israel formally in terms of what we call urgent appeals, because some of the issues are really important and urgent. Some of the letters and the work takes a bit of time, but I can tell you that in all these times that I've engaged with them formally in those processes, they have not responded. The other way is to advocate publicly, of course, and so I have been with everything that I can through different mediums, always calling for the release of all of the healthcare workers, calling for investigations of those who have been killed, calling for an end to the occupation. Because until the occupation ends, there won't be peace. We need an end to the occupation, immediate unconditional ceasefire. And of course, part of the hostages that were released, we're hoping that our colleague would be part of it. But you need to remember that these people, their intention is to cause harm and psychological trauma. So they extended his abduction and they extended his detention. Still, there's no charge. And so my mandate continues to engage in many different platforms, in many different ways, to call for the release of all of them. And I know that he particularly does not want to be an icon in terms of, healthcare workers. But his story and his experience, of course, called all of us to action in a very different way. Watching him with that tank and walking towards that tank. That if that didn't do anything to you, then nothing will. And yes, there are many of our colleagues, unfortunately, who continue to be threatened. And that colleague you speak about, who's a pediatrician whose children were killed. I mean, where do you even start? Where do you even start? Yeah. And for me, I keep saying to people that I don't think our brains can really understand the magnitude of what we are going through. I think the matrix of the trauma and the literal levels of hell that have been unleashed, I don't think we can process that. Like our human brains have limitations to really understand what has happened on that ground. It's really, really bad. And so for me, my advocacy continues, and that's why the 2 reports this year are dedicated to health and care workers. It's precisely because of that commitment, that they must be understood as defenders of human rights. And in that way, there's a call to action, therefore, if we understand them that way. It's a dedication to them, those very colleagues that you mentioned. And that's why the Human Rights Council and the General Assembly reports this year focused on health and care workers, to bring light to those very challenges on reprisals, on intimidation, attacks, and it's been very important to do that. Yeah.
Are there any other questions in the room? No, we don't have any questions online, so I will thank Dr. Tlaleng for her briefing. And I will also take the opportunity to invite up Special Rapporteur Atiya Waris, who is joining us for the next briefing.
Thank you very much.